Premier Ford announced new steps to combat the rising number of COVID-19 cases earlier this week. Joining us now to discuss those new measures, we have Niagara Centre MPP Jeff Burch. Jeff, is this enough, or is it a case of too little, too late in your eyes?
Well, I think it is too little, too late, and I think most people understand that. It's been very frustrating, and obviously, we're seeing the results of what happened during Christmas, and that decision to kind of quote allow big box stores to deal with their inventory and keep things open until Boxing Day. We've seen over the last few days certainly the impact of that decision. And so there's no question it's too little too late. And what I'm hearing today, and what I think a lot of people are saying, is that the measures are very confusing as well to people trying to really understand for those people who are really, trying to follow those restrictions, just trying to understand them so that they can follow them the way that they're supposed to. Most people in Ontario are law abiding, and they want to help out, and they want to follow those restrictions and keep their neighbors and their families safe. But you have to understand what they are in order to follow them.
We have some pretty serious numbers right now. We're up to 90 deaths in Niagara. 50 of those have happened since what we call the second wave has come about. That's very, very alarming. We're in receipt this week of a letter from the Medical Advisory Committee with Niagara Health, and they are really pushing back, it seems, against the province and how they're treating Niagara. What can be done to make sure that Niagara is better served by the province?
Well, I was just going over that, and I don't think it's just Niagara. I think that there's a general, a general confusion across the province, and so there are some regions like ours who are not getting the attention they deserve. And I think that really the root of that problem, Mike, is that certainly what I'm hearing is they're not dealing with local health units on the ground. And just like anything else, it's local people that know what's going on. And as municipal affairs critic, I know that as well as anyone else. It's your local health units and your local municipalities who are seeing what's happening on the ground and who know best how to do something like a vaccine rollout. And so what I'm hearing is that the province is just not listening to the people on the ground. And I think that's really the key to making sure that something that is central, that needs to be rolled out locally, is done effectively. You got to listen to the people on the ground that know how to do it the best.
Were you surprised at reading that letter that the Medical Advisory Committee would sit down and put that two-page letter together calling for community support to lobby the government?
No, I wasn't surprised. And we're all frustrated, but when the medical community and when the people who really know what they're doing and who know the science and are experts are this concerned about how we're being treated, I think that's a great cause for all of us to be very concerned.
Our acting medical officer of health, Dr. Mustafa Hirji, has also been vocal that he would like more say here locally in how the vaccine is administered.
Yeah, and I have huge respect for Dr. Hirji. I think he's done a wonderful job. I know many of his 10 public health nurses that are just working 24/7, and I think they've done a fantastic job. And he's trying to give his advice on what is the best way to deal with this in our local area. And he said very clearly that we need that vaccine, and we need it to get into the arms of nursing home, of long-term care residents. That's key. And as I said before, we really need to be listening to the experts and people, especially local experts, that know exactly what we need to do to most efficiently and effectively deal with this here in Niagara. And it concerns me they're not being listened to.
The vaccine did arrive, the Pfizer vaccine did arrive this week, so that will start to be rolled out to the healthcare workers first. The general population won't really be receiving this until at earliest sometime in August. Is that acceptable in your eyes?
Well, look, I mean, we're all working as hard as we can. I don't. I mean, I'll go back to the Christmas period again, and we had lots of time in the summer to prepare for this, and I think everyone knows we didn't do the preparation we needed for the second wave. And then over Christmas, in addition to the to the inadequate measures over the Christmas shopping period, to hear that they kind of took a vacation from vaccinations over Christmas. I mean, it's pretty clear that we haven't had the urgency that we should have, and so yeah, it concerns me. And if we had ramped things up as some other jurisdictions are doing, and this isn't just partisanship. You can look at the data and best practices in other countries and see who's getting it out quickest. We're behind, and we've not done the job that we need to do. So it is concerning to me, and uh, we have to administer the criticism, and then we have to figure out how we're going to fix it, and just get things out as quickly as possible, and work together to do that, because every delay means lives.
Thank you very much for your time today, Jeff. That's Jeff Burch, MPP, Niagara Centre.
Thank you, Mike. Appreciate it.